Hi everyone. I am here tonight to talk to you about brain development and its connection to early language and literacy. First, what I'd like you to do is think about a couple questions. First is, what are your thoughts about brain development? Nature versus nurture? Which camp do you sit in? And second is, can you name three factors that could potentially inhibit a child's brain development? So you don't have to necessarily make a list, just mentally kind of prepare your answers and think about those as we move on with the presentation. So, how does the brain work? Uh, Genetics versus experiences, nature versus nurture, which is it? Um, Over time, theories have evolved to include both genetic and environmental factors to explain how the brain works. So it is a combination of the two, although it's still up for debate exactly how much each has an influence over brain development. Um, billions, the brain is formed by billions of brain cells during the first 3 months in the womb. At its peak, the embryo is generating 250,000 cells per minute, which is just an amazingly high number. Um, this fact really emphasizes the importance of prenatal care and awareness, as the first trimester is such a critical period for brain development. If injured, the brain is capable of recovering over time, depending on the severity of the injury. And also, all areas of development are controlled by the brain, which is a really important fact to keep in mind as we move along. So, the synapses, these are the connections that are made between cells. Between 0 and 8 months of age, the number of synapses increases from 50 trillion to 1,000 trillion. Um, Learning occurs when the synapses are formed. Only the connections that are reinforced stay. The others disappear. Synapses are formed through experiences. Children must experience their environment to make these connections permanent in their brain. The lack of experiences will stunt brain development and growth, as well as learning. The brain initially overproduces synapses to ensure it can adapt to any environment the infant is exposed to. And just for the sake of definitions for early language and literacy, um, language is defined as oral language development. It's the communicating by speaking and listening. Preferably, this is learned through conversation between the caregiver and the child, mostly during the infancy, young toddler age period, and it ideally begins at birth. Those conversations that a parent has with their nonverbal baby are really important. Literacy is defined as the reading and writing, communicating through print, and young children who are consistently read to demonstrate higher literacy skills at school. So that also begins ideally at birth. Some may even say before birth to enhance those skills when for school readiness. So, what does the brain have to do with early language and literacy? Really, it has everything to do with it. Repeated daily interactions are critical for the enforcement of the connections of the synapses. Um, this goes for both positive and negative interactions. Both positive and negative interactions are reinforceable. That's why it's important for children to have positive interactions with caregivers. Children who experience frequent, inconsistent, or negative interactions result in the child learning and remembering that behavior, that negative behavior or experience, and storing that away. Sensory input is important. Children need the physical experience of using one's body to learn about objects in the surrounding environment. They need to be provided with the opportunity to safely explore their environment, which can be a challenge for some families living in poverty. But that is an important step for development, brain development, as well as cognitive and learning skills. Visual involvement is also important. Children need a variety of stimulating visuals, particularly during the first year of life. This sets them up for their early reading and writing skills. It's the foundation needed. Audiological input is another critical piece of brain development. And babies need to listen to words. They need to listen to a variety of vocabulary and inflections from their caregivers, and this will set them up for their oral language development. Also important to the brain in early language and literacy skills is attachment. Infants need to form a secure bond with caregivers. Attachment is the pattern. It's a pattern that emerges over time from interactions between a child and the caregiver. It's a predictable parental responses to infants crying or showing stress. Children who are able to form secure attachments are then confident enough to venture off to explore their environment. They gain experiences. How a child attaches to their caregiver determines their future abilities to regulate their emotions and to be successful socially, as well as it affects their overall cognitive and emotional development. Children who experience feelings of stress and fear on a consistent or regular basis, whenever those feelings start, they release the hormone cortisol to the brain that can actually destroy brain cells, which of course can inhibit brain development. So that's why the attachment is so important, and parents being able to know when their child, to know their child's actions and to be able to respond accordingly. So attachment. A couple questions, again, just to think about, nothing that you need to write down, but just kind of mentally prepare a list of what can parents do to promote a secure attachment with their child, as well as what can early interventionists do to support parents as they work to form that bond. So a few things a parent can do is to, this list of course is not all inclusive, it's just a few things. I'm sure you can think of a few others, but a parent can make sure that they're responding consistently to their baby, model appropriate coping mechanisms to stress or fear for their baby, as well as provide their child with warm physical contact on a regular and consistent basis. And caregivers or early interventionists, the best way to support a parent is through teaching parents to read their baby's signals and to respond appropriately, to support mothers showing signs of depression. The earlier that is detected, the better able the parent is to overcome that challenge and to form a secure attachment. And also, parent support groups are really helpful for that as well. So who is most at risk? Children who are not given opportunities for interactions, children who are exposed to drug, alcohol, chemicals, and or stress in the womb, Children who have a mother diagnosed with depression or is demonstrating symptoms of depression, and children who are highly sensitive or had a premature birth, and children who have a diagnosed brain-related disability such as autism or MR. These children have an increased likelihood of experiencing atypical brain development, and this can result in decreased learning, cognitive, and emotional development. So, lastly, what can we do as early intervention caregivers for these children? Early intervention can and should not wait until a child is born. The goal is that every child should enter the school ready to learn, and the preparation needs to begin before birth. It's a critical time in the first trimester for the brain to develop appropriately, and that isn't possible without appropriate interventions prenatally. Research shows that early intervention provided for the first 3 years of life can significantly negate environmental factors such as poverty, substance exposure in the womb, and maternal depression are just a few of the things that having that consistent early interventionist in the home. Parent education is also very important. Parents or teachers, they are the primary vehicle for teaching literacy skills. And it's not an inherent skill. It's not something that someone just knows how to do necessarily. And it's so important that we show parents how to read to their child, what the best books are, how to be models, writing their lists at home, showing their children how to use print. Parents don't necessarily know how to do that and need to be shown. We also need to learn to recognize signs of maternal depression and make appropriate referrals to mental health agencies. This is, the sooner this happens, the better. And a mother can overcome that challenge and be able to respond to her baby better the earlier that she's treated. And lastly, we need to stay up to date as care providers on the implications of any new brain development research and be able to apply it in our everyday work. There's always something new and new, more effective strategies to know, and making that part of our training and personal development and professional development is important. So thank you for your time, and hope I was able to give you a little more insight.